We have several questions from our audience, but first I would like to call Dr. Angela Fleischman because she made it to connect right now and to answer the questions about nutrition in her session previously. I hope, yes, she's here. Um, So, Angela, the first question from our attendees is the following. Although living on a Mediterranean diet for most of my life, I did suffer from severe PV symptoms, watch and wait for 12 years now, until I started with potentially anti-inflammatory nutrition supplements, curcuma, senka tea, and pomegranate, which helped me in losing nearly all of the MPN-related symptoms. My question is, will there be studies on higher dose nutritional supplements to reduce symptom burden in the future and maybe also slow down MPN progression?
So that's a very good question. Can you hear me? Number one, can you hear me? Okay, good.
Yes.
So that's a very good question. With studies and in particular studies involving humans, we need to start very slowly and start from the beginning. So our first thought was with the diet that it's not a drug. It's really low risk, no risk. And in America, you know, many people do not have a great diet. So we thought that the first step would be simply encouraging them to adopt a healthy diet, such as a Mediterranean diet, which includes a lot of anti-inflammatory foods. Yes, then the next step in the future, we will plan on incorporating more aggressive anti-inflammatory measures, such as supplements. But for right now, we want to start simple with a Mediterranean diet. And it was interesting in our pilot study that the people who seemed to get the most benefit were the people who had the worst diets to begin with. That a Mediterranean diet was a significant improvement for them, whereas the people who already had a very healthy diet, obviously adopting a Mediterranean diet, which is not much different than their regular diet, didn't really do them much good because they were already eating healthy.
Okay, thank you, Angela. Another question for you. It is about balanced diet based on genuine ingredients is the foundation of good health. Are there foods MPN patients should prefer and foods they should avoid?
That's a good question. People with PV should try to avoid foods with lots of iron in them. But honestly, beyond that, you know, from my perspective, I think it's a general common sense that people should have a well-balanced, healthy diet. Everybody wants some sort of magic bullet. Oh, if I eat this, I'll be healthy. But I think it's more of a holistic approach that, you know, in general, you choose healthy foods to eat. You don't, you know, it's going to be boring to eat the same thing every day. But other than high iron foods, at this point in time, we really don't have any recommendations of specific foods that PV patients should eat or shouldn't eat. And I think in the end, it will be a more holistic, healthy eating pattern rather than specific things.
Okay, thank you. So this is a question about COVID infection and diet. What diet would you suggest in the period of convalescence from COVID infection? And is there scientific evidence of foods, diets that can reduce the risk of COVID infection?
That's a good question that I never even thought about. I really cannot answer that question. That's a very interesting and complicated question, but
yeah. Yeah. And as you mentioned before, something about pomegranate is complementary nutrition for MPN and other patients. Do you have any data about this specific fruit?
We don't have any specific data about pomegranates per se. In certain cultures, pomegranates are used more frequently than in others. But at the present time, we're starting simple. In the future, we can look at more specific things. And that also brings up another important point, that one needs to incorporate the common foods that are in each culture into a sort of a specific MPN diet for each culture, so the MPN patients can eat what they're used to, but adapt it towards for them. But that's a very, very good point.
Thank you, Angela, so much that you joined this panel, and thank you for your presentation.
I'm sorry I was late. I didn't realize it was European time.
No problem. Thank you. So now we have one question for Zach. One of the objections raised in the scientific world and by companies regarding the surveys designed by patient association is that the questionnaire is not validated. How can we overcome this false obstacle?
So I think there's a number of parts to that question there. The first is not all of the evidence that we're trying to generate is to influence the scientific community. So in those settings, it doesn't matter whether it's scientifically validated for those purposes. It depends what you're trying to do with it. But if we are focusing very specifically on evidence that's generated for scientific publication to show clinically significant differences, then I would disagree with the question. I don't think it is a false problem. So as patient organisations, if we're trying to get involved in science, we need to adhere to similar standards to those of scientists. So if we're looking to run questionnaires that drive scientific change, then we need to be looking at using validated questionnaires. That doesn't mean developing your own validated questionnaires, but there are plenty of existing patient-reported outcome measures, many that are not in widespread usage, but that have already been developed and validated. And one of the things that we did as the Global Acute Leukemia Advocates Network was we took a validated patient-reported outcome measure that was specific for hematology, which was the HM Pro, and we incorporated that as part of our questionnaire. So when we were asking questions about patient experience, those questions, we could then map those against the validated HM Pro. The HM Pro obviously didn't ask all of the questions that we wanted to ask to our patients, but what we could do was we could ask questions about what patients were experiencing and see how they impacted on quality of life as measured by the HM Pro. That enabled the findings to be more scientifically validated. And if you don't want to do something like that, you can, as I mentioned in the presentation, go to places where existing questionnaires already are, where the questions in themselves have been validated. So ERTC, for example, has an item library that hosts loads and loads of questions, and you can pick and choose individual questions from there so that the questions have been asked in a validated way, and then you can compare them to where those questionnaires have been used in other places.
Okay, thank you, Zach. So there is one question for Yura. What factor allowed you and your organization to work with doctors? What do you suggest to other organizations to be as successful as you are as in your organization? What are the obstacles you have faced working with the scientific community? So actually there are 3 questions here in one.
Well, I think I'll start by saying that the situation today of collaborating with the scientific community is completely different than what it was 20 years ago when I started advocacy. At that time, I think the scientific community did not really count as patient organization as partners to almost to anything. And I think today things has changed tremendously. I think the factors that most influenced our collaboration with the scientific community in Israel, and it's the same factor that is being influencing our activity on global level. When we work with the CML Advocate Network, with the scientific community on doing research and on developing new drugs, on sitting together on advisory board, is something that we are now used to do. So actually, when the MPN working group of the hematologists in Israel was created, they invited us, the patient organization, to be members of that working group, and we are participating in the meetings of this group. And when they designed the study, we are part of it. They invited us to be part of the study. So I think a good working relation with the scientific committee is a must for any patient organization. It's easier said than done because it depends a lot on personality. Still, not everyone in the scientific community is willing to collaborate, but I think things are changing, and this is the future. I think both parties today agree that it's a win-win situation, and the more we work together, the better results we get.
Okay, thank you so much. And there is a question for Michelle's presentation. How do you know if the FDA is adapting the data you are presenting in the PFDD meeting? Is there a further communication with the FDA after the meeting?
Yes, thank you. So I think the way to think about this meeting and the data that we already presented and that we will continue to share with them is that it's part of an ongoing body of work and advocacy with them. It's an ongoing conversation. We do believe that FDA takes this very seriously. To speak to Giyora's recent point, we've seen the evolution of the regulatory community, at least in the United States, really get behind the idea of working with patient groups more. And this was the FDA's initiative to incorporate the patient voice into how they look at drug development. We were really happy to see director level people at the PFDD meeting in person who they attended all day. And we believe they're taking this quite seriously. Our next step is to formalize the data presented at the meeting into a written report for the FDA, but to emphasize that we're going to use that as a springboard for additional work with them. I think this was mentioned by both Ruben and also Zach, that patients present information which can be taken as an anecdote, but what we need to do is back it up with more the hard data to back up what the meaningful impact of a symptom is and what relief of that symptom is. So it's one thing to say, these 10 patients have debilitating headaches or debilitating fatigue, and here's how you measure it. And then it's another thing to back that up with more rigor. And we feel like working with the members of the community that we already have begun to develop that relationship with will make a really strong case to the FDA and to others in the community working on behalf of patients. I hope that makes sense.
Yes, thank you, Michelle. And final question for Bahia. What are the main obstacles to implement AMAL's initiatives? What are the strengths? And who do you get support from? The citizens, the government, the philanthropic foundations? You should unmute, Bahia, I think you are muted.
Sorry, yeah.
Yeah.
Yeah. Now we have the support of everyone. As I said, sometimes is patient, sometimes is a volunteer, another organization also, because we have a partnership with many patient organization, for example, myeloma and other patient organization. But from the government in our region, it's very complicated because sometimes they give money to association making sports or making some arts. I'm not against this organization, but sometimes we should act by priority. The priority is patient, is access to treatment, is the support. We have many patients, they can't come to the hospital because they have not money of transportation. Regarding the partnership, we tried many times to have partnership with Ministry of Health, but they help us only once, and we have many challenges. We have many requests from patients, especially, for example, about testing. Testing is very expensive in Morocco, and sometimes without insurance, and the patient are struggling with this issue. Health insurance is a big issue. Now we start to make partnership with, as I said, with organization, and we have also our friends, our colleague. For example, they help when we have some case. We send the file, the medical file of this patient, and we collect money to save the life of patients. But unfortunately, in our region, we don't have the support of government, as I said.
Thank you very much, Bahia. And Yura also has question for Angela. You can ask Yura.
Yes, yes, I'm very glad that Angela is still with us. You know, Angela, that it's quite many MPN patients suffer from impaired immune system. And I wanted to ask you, do we have any special food that we can eat that can strengthen or make the immune system better?
That's a very good question, and everybody wants something. They want to eat something to sort of fix their problems. I know at this point I really don't feel qualified to answer that question, but I honestly feel it comes down to not one thing, but globally what you eat. You eat good foods and you don't eat too many bad foods. Obviously, you know, you like your cakes, things, you know, you always want to have a treat sometimes, but I honestly, I don't think it's one thing, but in general, eating a very healthy diet and avoiding too many bad foods. You know, eat good foods, but again, also don't eat very unhealthy foods. In America, a lot of people eat a lot of fast foods, packaged foods, and really have a very poor diet. So I think it's eating more fresh things and more in general things that are classified as healthy.
Okay, thanks a lot.
Thank you. And again, one last question for you, Angela. Are there any foods which MPN patients should avoid if having a weak immune system?
I guess things like, you know, things that might have bacteria in them. I mean, I honestly have not even thought about these things like raw foods, you know, sushi or raw meats, in which, you know, might be contaminated. But really, other than that, not necessarily that I can think of.
Okay, thank you so much. Now I would like to ask Param, is he online?
Yep. Thank you. Thank you. We are on to the last stage of concluding this session, and I would like to really thank all our speakers, Zach, Michelle, Giora, and Bahija, for stepping up and providing some real-time evidence on the works they do in their respective countries, which is very, very passionate, and I'm sure the listeners across the world are able to take one or two, specific actions. And there were some very forthcoming questions from few of you. And I think, for these advocates who have been building this community for many, many years and sharing it with across, during this format, I really like to thank all the speakers and all the participants who have been very proactively asking those questions, and also to the panelists from the previous session able to take forward some questions. So with this, we are now concluding this Advocacy 2 session of learning from on the real-time evidence. And I would like to hand over the next stage to the chairs for getting into the conclusion of this great, MPN Horizons 2. Over to you, Michelle and Midna.